Obesity, is a very important issue. It is affecting the whole world, and obesity is the root cause for a lot of serious illnesses, including cardiac disorders, various kind of cancers, metabolic disorders, hypertension. So the question that we wish to discuss today is, what is the yogic understanding of the problem of obesity? How to manage it from the yoga perspective, especially in adolescent population which are rapidly catching this illness?
Shubhodaya.
Yes.
Sir, it's a very relevant question and one of the important lifestyle based um, disease is as we all consider as of now. But however, it is not just a physical illness; it is a mental illness also. Most of the cases might be maybe very few cases. I'm not sure of the percentages, but those can be hereditary and secondary to a medical cause. But most of the cases, or most of the children who are being on the obese side, is secondary to the faulty healthy habits and the upbringing, the family upbringing, and how they have been taught to cope up with stress from the very childhood. Whenever the child is crying, give him food to pacify. Whenever the child is making demands, give him something. And especially the type of food that we are taking nowadays, there are mostly junk food. And especially it is increasing the rajas of the child initially. So definitely the child wants more and more of it. Rajas is increasing there. And also, so over the period of time, there is a pattern that is building that whenever I'm in stress, I can soothe myself by eating or doing drinking or high carbonated foods. So the children have this. We all have been in the phase, and we learn through this pattern recognition. So that has become one of the important patterns, and also the the very understanding of how to cope up with stress, the resilience. These have been not taught in our education curriculum. I feel yoga is one such thing that can build up resilience in calming yourselves, bringing down your anxiety or your ability to cope up with these situations. There is a saying in Kannada also, "Ondo ತಿನ್ನೋನು ಯೋಗಿ ಎರಡೋ ತಿನ್ನೋನು ಭೋಗಿ ಮೂರೋ ತಿನ್ನೋನು ರೋಗಿ ನಾಲ್ಕು ತಿನ್ನೋನು ಎತ್ಕೊಂಡು ಹೋಗಿ." It means that a person who eats once is a yogi, two times he is a worldly person who is a bhogi, three times he will definitely become a patient, four times if he eats is definitely going towards his death. So along with that, in Bhagavad Gita also it is quite uh, extensively told in multiple places. The things has to be done in moderation.
Yes.
Let it be anything. So it has to be done in moderation. Sleep, food, that is the characteristic of a yogi. So we all should strive towards that, is what I feel. And also there is a lot of not just children's burden, it's a parental burden also to understand these and to have that mm, the what we call um, the safety, or the safety ring for the child whenever the child is in stress, whether they can go back to the parents and discuss with them, because parents are so busy in their own things. I'm not sure where the children can go back and discuss. So if they have a good family and good network, so these things is a lifestyle thing can be addressed, and also build up the resilience of the child to address their own issues. These are a few thoughts.
Thank you, Dr. Avinash. Dr. Avinash brought in another important point, the way, the upbringing of the child takes place in the family. I am aware of quite a bit of families where, uh, a child is considered healthy only when the child is obese. Otherwise, the child is not healthy. क्या यार इतना पतला हो रहा है? People keep saying like that. A child who is actually fit, thin, lean, and fit is considered as ill, and a child who is actually growing, becoming obese is considered as a healthy child. And mothers, they overfeed the child, and that is actually a big problem. big problem, high calorie food, and they consider that they are making a child healthy, but they don't know that they are actually creating, the platform for heart diseases and several other problems in future by overfeeding the child. Yes, Dr. Avinash, you want to share something
So,
else?
so there is one other extreme also from obesity. There is other extreme that I have seen many children with anorexia also. So, so it's basically about eating, how we perceive food as, and how we regulate our emotions. So both are there. So I just wanted to bring up this point.
Yes, yes. So once they gain that weight and then they see that there are many activities, the fitness that other children have, they don't have, then there is a tendency to, overeat and then vomit, and then, so that is another kind of a problem, eating disorder. You go towards eating disorders. Fine. According to yoga, the Anadhija Vyadhi, which Nandini was talking about, are the illnesses which do not have any external cause like any infection, trauma, or injury. They arise from within. And yoga says that when you say that they are arising from within, from the physical body, you can go up to the genetic level. But then yoga says that even the genes, can be regulated. There are epigenetic switch which can switch off certain genes and make certain genes express. So it is not necessary that if your parents had a certain disease that you will definitely develop it. There are epigenetic mechanisms that you can protect yourself by following a healthy lifestyle. Then where how these genes get triggered or regulated, yoga says that prana does that, and prana is being regulated by the emotions in the mind. So this is how from the Manomaya Kosha, the illness gets into Pranamaya Kosha, and from Pranamaya Kosha, it gets into the Annamaya Kosha, that is the body, according to yoga. So therefore, in yogic understanding, mind plays a very important role, which modern, scientific evidence also says stress, stigma, and obesity. These are three very important things. With stress, what happens? Their cognition, their ability to think, their ability through which they cope, that changes their behavior, that changes their physiology, biochemistry. They become obese. Once they become obese, they develop a kind of a stigma. Okay, I am obese, I will not be able to participate in this, I will not be able to do this activity, people are actually laughing at me, and that makes them more stressful. That changes their body physiology more, they release more cortisol, they develop cognitive distortions more because of the stress. That makes them more obese, and people are caught up in this vicious cycle. Similarly, as Vibha was pointing out about the role of sleep, Nandini also said. So sleep insufficiency is another very important cause for obesity. Our time for our own, our self time, even for adolescent adults, is at night, when everybody has slept, and that self time is spent on screen, correct? And therefore, the in this busy lifestyle, hectic schedule, when people want to, unwind themselves, they expose themselves to screen, and what takes the toll is sleep. And therefore sleep leads to these inflammatory markers, insulin resistance, increased risk of diabetes and obesity. So both of them contribute to the high prevalence of diabetes. India has become a diabetic capital of the world now, and obesity is rapidly rising, and these major issues, I think sleep is playing a very important role. Now when you look at it from the yoga perspective, we all know that there are these 5 yamas, 5 fundamental rules that we need to follow. These are, for the harmony in the social sphere, how I interact with the society and how I maintain peace and calm and keep my stress levels low. The yama have to be followed, and the yamas are for self reflection on factor contributing to mental stress, correct? When I break yamas, I become more stressful, that is clear. Second is these niyamas. Niyamas are for my channelizing my energy in a constructive, productive direction. These are positive coping mechanisms, So if rather than eating, rather than, binge watching or reducing my physical activity, if I can cultivate, you know, a habit of, moving my body, contributing to cleanliness of the surrounding, cleanliness of my room, and then tapa means performing certain asanas, physical activity, going to gym, running, all that generates heat in the body is tapa. Santosha is being satisfied with one's own body, being accepting oneself, loving oneself. All these self-compassion comes in Santosha. Swadhyaya is about self-reflection and finding out the, notional imbalances. And Ishwar Pranidhana is ability to connect to a higher force, a higher principle in life. When a person, so it is to enhance mental resilience, you follow the niyamas, then the thought process, the atmosphere, the behaviors that go against these yamas and niyamas, they are known as vitarka badha. Okay, these are the contrary thought processes which are breaking the yamas and niyamas. And Patanjali says that more the vitarkas, lesser the mental resilience of the person, more the person would be stressful. And why does a person develop this vitarka? What is it within me that makes me break yamas and niyamas in my life? Patanjali says that it is because of three fundamental emotions, what Nandini was saying: lobha, krodha, and moha. Greed, anger, or attachment. These are the three fundamental emotions that create these imbalances which make a person break yama and niyama. This is common for all the NCDs, but when you come to obesity specifically and look at some scientific evidence, recently, people have been able to demonstrate that a certain area in the brain of the individual, especially the amygdala, hippocampus, is actually bigger in people who are obese. So amygdala is one area of the brain which is the emotional cortex, where we actually store a lot of negative emotions, lot of anger, lot of jealousy, and that area is becoming bigger in obesity. In fact, people have been pointing out that the fat in the body is actually an inflammatory tissue. It releases a lot of inflammatory cytokines which generate inflammation in the body, and this fat is nothing but stored up anger. So krodha is the emotion of the three, which dominates in a person who has obesity, and he has a lot of suppressed anger within him. And this anger and frustration is what the person tries to take out and cope by binge eating and doing less physical activity, or binge watching, or exposing themselves excessively to the gadget. But fundamentally, in my own clinical experience also, whenever I see a person who is developing a lot of weight, metabolic syndrome, when I ask them, I realize that the person is either angry on the world around him, or he is really angry with himself. And that is manifesting as overactive amygdala, and the suppressed anger is accumulating as the inflammatory tissue, which is fat, retroperitoneal, the under the skin, everywhere you see this fat is actually a lot of suppressed, intense energy, that needs to be channelized. So therefore, in obesity, one of the important mechanisms is how can they channelize their emotion, sublimate the anger and the suppressed anger into more productive kind of an activity. And it is here that the fast yogic breathing practices like Bhastrika, like Kapalabhati, fast dynamic Surya Namaskara, where they actually imagine the situations where they were really frustrated, and they, rather than eating, they do Bhastrika pranayama and take out their anger, because CO2 washout is also connected to loss of weight. So there have been number of studies, a systematic review and meta-analysis also, including 30 randomized controlled trials, more than 2000 patients. It has been able to demonstrate that yoga is safe and effective intervention to reduce body mass index in overweight or obese individuals. This is actually a nice study performed in All India Institute of Ayurveda, New Delhi, where children and adolescents with obesity were taken. And there was AIMS, no, there is a pediatric division of AIMS New Delhi. Dr. Vandana Jain is also involved. And what they did was they performed a 3-arm RCT. Standard weight management was one group, yoga with dietary modification was another group, and control, no intervention, was another group. They observed that both standard treatment and yoga arm showed significant reduction in BMI, which was primary outcome. Additionally, yoga arm also demonstrated better control on blood pressure, which was not demonstrated by other arms. Why? Because yoga fundamentally works at the level of the mind. And through the mind only, from the pranamaya kosha only, obesity is also developing and hypertension is also developing. So yoga standard weight management is more peripheral, restrict calories, do physical activity and all. But at the core, you have to learn the art of managing the emotion, sublimating the emotion. That is what is the added advantage of yoga. And therefore we see better outcomes. So relaxation at the end plays a very important role. These were the practices used in that trial. Vajrasana, Padmasana, Sukhasana, Surya Namaskara becomes a very, very important practice. If a person is really morbidly obese, then each step of Surya Namaskara can become a separate asana. That is another way in which you can do it. You can see that people have mainly focused on giving a nice twist to the abdomen. There are, Ardha Vrikshasana is there, Ardha Chakrasana is there, Ardha Kati Chakrasana is there, Dhanurasana, Makarasana, and they have not provided the detail of pranayama, but I feel that the pranayama practices should be more activating, fast breathing practices should be there. Another study which used only Surya Namaskara as compared to treadmill and circuit training in obese females, where the average age was 20 to 40. It was observed that with Surya Namaskara as well as circuit training, there was a improved cardiorespiratory fitness, and Surya Namaskara led to extra flexibility of the body, which was not observed with other aspects. So you can lose calorie by treadmill, gym also, but if you do Surya Namaskara, added advantage is that you will develop extra flexibility and endurance, cardiorespiratory fitness as well. So how is the practice of yoga related to weight status? This is another position paper. So cross-sectional survey with 5-year longitudinal follow-up, in 183 young adults was done. Regular yoga practice reduced 5-year BMI, So long-term effect are also there. It is not that only till you do yoga, you will feel better. If yoga becomes a part of your lifestyle, you can observe long-term benefits. So people who just stop it again gain weight, all weight training, diet, what you do are temporary. But yoga, if regularly done, changes the very personality of the individual, changes the way the individual sees his emotion. People also become more aware of their body, their breath, their emotions. So insula is one area which improves the introspective ability. And that self-awareness that comes with yoga actually plays a very, very important role in long-term attitudinal change and the coping strategies in which the individual is doing. And that's why in the long run, if yoga becomes a part of the life of an adolescent, can have a lasting benefit. And frequency of yoga was inversely associated with weight gain. People, the more they regularly they do, they were observing better benefits. So less weight gain over period, particularly in overweight young adults, practicing yoga on regular basis may help prevent weight gain also. So if there is a high risk in the family, you can use epigenetic mechanisms to prevent the problem from coming, even if your parents have it. So what was the main reason in this survey for people for practicing yoga? So almost, you see that the 90% of the people said that stress reduction and relaxation, enhanced flexibility, reduce back pain. Back pain is another problem which goes commonly with obesity, because the abdominal fat becomes so much, back gets extra pressure. Feel better about my body. Especially for adolescent, I feel that if you can do classes in groups, yoga session in group, all of them can join together, nobody has any kind of bodily stigma, and then their adherence is much better. Rather than doing yoga alone, on your own, it is very difficult. But all, adolescent, whether they are overweight, obese or normal, should gather together. Every apartment should start this. All adolescents should come in a hall, even if it is not possible to do it every day, at least on weekends or at least once a week. They can start doing some Surya Namaskara, Bhastrika, Kapalabhati, and then deep relaxation with Om chanting to calm down the amygdala. That is what I feel that as a nation we have to focus on. Schools, are another thing which can adopt this. It is a very simple 20-minute module that can be done after assembly, in schools. So I request and appeal all the people who are there, if in your capacity, if there is anything like that that can be done for adolescent, then we from Nimhans are more than happy to help and design these programs. Enhance spirituality is added benefit of yoga. There are studies where people have found that without giving any kind of a health education or spiritual advices, just by practice of yoga, people started getting up early in the morning, sleeping early in the night, avoiding junk food. You don't feel like disturbing that atmosphere that comes within for with yoga, and you become more aware that, oh, after eating this, all that I gained through yoga is gone. So your brain starts giving you feedback what you should eat, what you should not. So that is the beauty of yoga practices. And behavioral changes, quality of life, improvement of mood, reduction in stress, immune modulation, sympathovagal balance, reduction of insulin resistance, autonomic balance. There are various, varied mechanisms through which the holistic practice of yoga is able to contribute. This is also published in a very good impact journal. So behavioral, psychological, and physiological thing, and prevention as well as management can be done uh, of all the burning issues which are actually troubling our society, especially in India now. This is another study where psychological distress and obesity were addressed. And these are the set of asanas, which I was talking about. And yoga was considered as an effective tool to improve anxiety and depression as well as obesity. Here, dietary restriction advice was not given, only yoga. People were only asked to practice yoga. Otherwise, people really feel, oh, everybody tells me not to eat. So, okay, you do whatever you want, but do yoga. And slowly it was observed that people in them also, the mood and anxiety improved. And definitely over a period of time, these people automatically start assuming a positive lifestyle. So that is these are some references for psychological benefits of yoga in reduction in stress. This is Kripalu yoga, which apart from the asana pranayama also focuses a lot on the spiritual domain of chanting of the mantras. That also has a calming effect on the amygdala, which is the center of this problem. So if given a chance, I would like to start with Tadasana stretch, nice twisting of the spine, then performing this rotation of Sarvanga Pushti, a very good practice included in the diabetes module by Ministry of Ayush also. Surya Namaskara is the main crux at the physical level. Veerbhadrasana to strengthen the muscles, improve the confidence level and self-esteem. Balancing asanas, especially adolescent, like that challenge. How long can I maintain my posture before and after certain duration of practices? Then it is very important, these obese females are at risk of PCOS and the menstrual irregularities. So therefore, Baddha Konasana and butterfly becomes a very important part after the relaxation in Surya Namaskara. Then of course, Vakrasana, sitting twisted pose is very important. Janu Shirshasana is another sitting twisted pose. Sarpasana to strengthen the back, because back also needs strength in this population. Setu Bandhasana is another very good asana to improve the core strength and back muscles. Then to regulate the emotion, you can begin in children and adolescent with simple 4-4-4-4, then go to 4-8-4-4, go to 4-12-8-4, 4-16-8-4. You can reach in 3 months. But simply you can begin by doing 4-4-4-4 breathing in Chin Mudra, Chinmay Mudra, or Adi Mudra, 3 mudras. Regulation of the breath can help regulate the emotions. And then comes the faster yogic breathing practices of Kapalabhati, where you pull your abdomen and breathe out through the nostrils. No? And you can start with slower rate and gradually increase it based on the capacity. Perform then the Unmani practice or the Bahya Kumbhaka. Then do Bhastrika to vent out all anger and frustration, and selectively perform Surya Anulom Vilom. Close the left nostril, breathe in through the right, breathe out through the right. Perform 27 cycles 3 times a day. There has been a trial in Svyasa where they divided the group into 2 arms, left and right, and perform it for a month 3 times a day. And they actually were able to demonstrate that people who only perform right nostril breathing 3 times a day, activated their Surya Nadi 3 times in a day, were actually able to lose 4 kgs average weight without doing any other physical activity, So that is the impact of just channelizing your energies into more activating way through yogic techniques. So then, of course, Om chanting, Auma chanting is for the vibration in the brain. We have demonstrated in Nimans that chanting Om inside the MRI scanner can actually lead to limbic deactivation, amygdala deactivation. So these are the practices that we want to perform, and thank you. Thank you very much, all of you, for your patient listening. Any final comments from anybody? Yes.
Good morning, sir. So this is very nice session, and I have been telling to my daughter that you come along and do a yoga, but she is a little reluctant about this. And so can you please share this session on the YouTube so that we can.
I'll put it on YouTube, madam. In next class, I can share the link also. But I think that your daughter may not like coming with you, but she may like going with more people like her, who are also, similar to her. If your daughter is obese, if there are other obese ladies who are there who will, confidently do yoga, then they will like it. So therefore, they want peers. They want you have to gather all of them together, and then I have seen that people adhere to yoga quite regularly because it is another way of they socializing together and feeling a sense of belonging to a community. Yes.
Yeah, sure, sir. Thank you so much. And this is very wonderful session, like which will help like all kids, adolescents.
Yes, Preeti
Sir,
madam.
One more thing I like to add that is fasting, like vrata, weekly once, monthly once. Fasting plays a very important role. So I had seen some of the patients were fasting like on Fridays or some Thursdays with a little water and milk and little
And
fruits. And that played a very important role there, maintaining the body weight also, sir. I had seen the patients.
good for prevention, but adolescents, it may be difficult. Probably they can develop that resilience through yoga practices and then do more tapas of fasting. Okay, Preeti ji, please share your views.
sir,
Yes, so sorry.
yeah,
Continue.
sir. Yes, sir. So please give me some time in the end, maybe. So I just need one clarification for the question. So maybe I can select.
Yeah. Yes, Preeti ji.
Sir, thank you so much. So I just want to tell everybody that we already have yoga modules for children there on Sir's YouTube channel, and I often prescribe it to patients. So I think we should continue to use those modules. Those are really nice modules for 5 to 10 years and 10 to 15 years. So that was one point. And second, also, I wanted to just say, sir, that obesity roots may even start in utero. So
Hmm.
that's very important to take the care of the pregnant lady, because a lot of now developmental origin of adult diseases start there, right there. So a pregnant lady, I'm not even saying the mother, it also has to be the father. The father also has to take care of the mother. And lot of trauma at that time and inadequate diet, anemia, malnutrition can set the roots for obesity. And the second thing is adverse childhood experiences. They can also cause obesity. So it's very important to ensure psychosocial wellness in children and adolescents and take care of the adverse childhood experiences like substance use, like so much of trauma which they face due to physical abuse, sexual abuse, or due to
Yes, yes. Preeti ji, we can't hear you.
day.
Yes, yes.
And the theme of the World Obesity Day this time is change the systems. Just don't blame the individual alone, like having yoga available in the vicinity, having a playground available in the vicinity, increasing the taxes on all these unhealthy foods also have an important role to play in prevention of obesity.
Yes. Yes, Preeti ji. Preeti ji is an expert. She is, a pediatrician who deals with adolescent health, and she's a renowned pediatrician in Bangalore. And it is really, really a valuable advice. We understand that the roots are there in the trauma, that is caused, and to the pregnant lady also. It is at that time that the seeds of obesity in the child are sown. So it is very, very important that mother during pregnancy also does yoga. The whole family, does yoga and become more sensitive about each other. Kambam Raghunathji, you want to say anything? Final word?
Yes, sir. So far yoga is concerned, it has given me a lot of impact on my life because I used to weight about 88 kgs. Now I am about 70 without losing any of my activities because I do yoga almost 3 times a day. And I don't feel dull also, and it keeps me more active.
Hmm.
And the yoga and as you said, even the various asanas what we do has definitely brought my weight down and make me more active in my life and more healthy in my outlook.
Thank you, Kambam Raghunathji, sharing your experience, especially, at your age, if people are able to remain fit and balanced, then definitely children will definitely feel more positive and healthy because they have lot of vital energy which can be channelized through yoga. Thank you. Very inspiring, very inspiring for all of us, Kambam Raghunathji, that you at this age are so regular. All the very best. Thank you. Thank you, all of you. Namaste.